Hi, it's Kristan Hawkins, CEO of the Pro-Life Generation, host of the Kristan Hawkins Show. I want to show you this latest ad from the Biden campaign and have a pro-life OBGYN respond to it.
So this is one of our willow boxes. This is just filled with some of the things that we had started gathering for her while I was pregnant.
Yep.
There's her little baby book. This is the outfit that she was gonna maybe wear home from the hospital. All of these. This is the blanket that she was in. These are her little footprints.
It's okay. I'm Joe Biden, and I approve this message.
Dr. Bruchalski, I want to bring you on a comment about this because this is a horrific story, and I find it so horrendous that the Biden administration and the campaign is trying to use this tragedy to justify 100% of abortions, which is what they support, which is what they're trying to pass if he is reelected as president this year. But I want your medical opinion. What is going on there? Is abortion ever medically necessary to save the life of the mother, like in Amanda's case?
First off, Kristan, my heart goes out to that woman whose story is tragically misleading on this point of whether abortion, elective abortion, is ever necessary to save the life of the mother. My heart goes out. And I'm John Bruchalski, board certified OBGYN, practiced for 30 years, life-affirming medicine. However, the first 2 years of my residency, I performed abortions to try to save the life of the mother. I tried to practice it right alongside practicing excellent medicine. You can't do it. This young lady was caught with ruptured membranes very early on, and she was let go by the medical community. There was no accompaniment. Remember, just because water breaks doesn't mean that you have to immediately do an abortion. Oftentimes, medicine, the fluid will reaccumulate. And in many cases, the American College will say, of OBGYN will say, take a wait and see attitude, make sure you do your best medicine, check for infection, check for hemorrhage, and see if the fluid reaccumulates. That easily could have been done inside a office, inside a hospital, or even at home with excellent follow-up. This is a tragedy all around. Excellent life-affirming medicine, as soon as the disease manifests, you treat the disease. You don't have to pit mom against her unborn child. There's no medical reason why a child should be killed in the uterus of its mother to save her life. Ever. Sometimes you have to empty the uterus, which is a treatment, but you always do it by treating the disease and trying to get both the mom and her unborn child to a place where they can both live. Sometimes when issues like this come up, life-affirming medicine, not abortion, is going to save this woman.
Thank you for that. I think that's so important. It's being left out of the conversation nationally when these ads come up. And I think this is sadly going to be the first of many ads exploiting the tragedy a family has faced, but using it to justify all abortions. And I think that's what's also being left off here at the end of this, where it says, you know, I approve, I'm Joe Biden, I approve this message. I also support abortion up until the moment of birth for any reason and taxpayer funds. That's been left out of the disclaimer here. But when you're thinking about, and I guess as a doctor, when you're presented with this type of case, and she's obviously the child hasn't reached the point where the child can live outside of the womb. It's a maternal fetal separation, right? It's a delivery of the child. It's a, as you refer to, as emptying of the uterus, but it's not going into the uterus and directly killing the child, right?
It's called treatment, not elective abortion. Elective abortion is never treatment, because in excellent life affirming medicine, what? We care for two patients, psychologically and medically. There is no good reason to electively abort a unborn child in the womb or uterus of its mother. Never. Treatment, sometimes you have to separate the placenta and the child from the lining of the uterus in order to treat the infection, in order to treat the hemorrhage, in order to treat the bad placenta. You don't ever have to directly intend. Elective abortion means I need to kill the infant, and that's the desired outcome. That is so far removed from excellent life affirming healthcare.
What do you say to an OBGYN that says, yes, abortion is sometimes medically necessary?
I would say to them, is that coming from a place of worrying about being sued or practicing excellent medicine? When I started, we often recommended abortion, elective abortion for diabetes. But because medicine has improved, we don't do that anymore. We can take care of women. There's been this correlated excellent technology that has come alongside the barbaric, ancient, outdated treatment that is called an elective abortion. It's brutal. Healthcare is about healing and caring to patients, not violence and hatred, only using one patient to say the other patient doesn't have any right to live. And so I tell them there's excellent medicine out there. Check her temperature in a case of, say, a ruptured membranes. Check a blood count every so often. Check her fever, maternal fever. Check her temperature every afternoon. If you begin to see any of those getting worse, you gotta deliver the mother. And you do it with consultation and communication, never pitting one against the other, but you saying, you know, this is going in a bad direction. We need to intervene now. That's not an elective abortion. It's treatment that is going after whatever the underlying causes.
Do you think this rhetoric pits mother against child? Where, I mean, clearly this mother in the video is grieving the loss of her daughter, Willow. But do you think this messaging broadly pits woman against child?
For 50 years of Roe, we've done this psychologically and sociologically and medically. And now, because states are able to put reasonable common sense limitations on the scourge of abortion, and recognizing that they have less and less doctors performing abortions or providing the chemicals, the poisons, I think they're reaching for straws. My heart goes out to this mother. My God, no one should have to go through this. This was not good medicine at many different levels. And to say that it's due to Trump or to say that it's due to non-legalities of abortion, we've been practicing excellent medicine despite abortion being on the books. Is it something in your heart as a provider, as a practitioner, as a physician to do no harm? Or are you just run of the mill, kind of getting a paycheck, worrying about being sued? My God, if you practice excellent medicine, you can stand on your 2 feet and you can be proud of the care you've given both mom and her unborn child, meeting them in whatever space they are. That's the tragedy here. I think this woman was sold short
Mhm.
drastically. And now it's the blame game, and we go to those sound bites. We don't know the details of this case. How can we fully comment? Well, it's because they're using it to pull at heartstrings
Yeah,
when they really
absolutely.
want abortion on demand for any reason at any time to be done in any way humanly possible.
Well, thank you, Dr. B, for coming on and giving your expert opinion. I really appreciate that. And I hope you all who are tuning in can take this information and help spread real information online to counter the misinformation being spread by the Biden campaign and the abortion lobby, who is schlepping for votes and trying to get the majority of Americans who don't tolerate abortion and don't want to tolerate abortion to somehow vote for candidates and party members who want abortion to be legal in all 9 months for whatever reason, taxpayer funded, and strip out the conscience rights of pro-life OBGYNs and doctors like Dr. Bruchalski and nurses and pharmacists across the country. Thank you for tuning in.